Hello everyone, my name is Rick Holland, the owner of Healthy Tech Talk, and I am delighted that you are here today. I wanted to talk to you today about going to the Jim Pattison Pain Clinic in Surrey. That place is an amazing place. And to be honest with you, I'll tell you a little bit about my story. A couple of years ago, I was hurt. I hurt my neck at where I worked. And it was bad. And I finally had to pay for an MRI. And the doctors looked at me and says, "Oh, yeah, look at that." So, severe stenosis, myofascia pain, pinched nerve, a whole bunch of other stuff that really took me out of the game, debilitated me for, a year and a half. And then I finally found a combination of therapy and medical pharmaceuticals that allowed me to get my life back. One of them is gabapentin, and another one we're going to put me on codeine content because I do well on codeine. Strange enough, T3s work really well for me, so we're going to change my regime. But if you're suffering from chronic pain, here's what I'm going to do. I've launched a business called eFlexonics, and what we do is webcast and social media solutions. So it's like a little television series for small business owners. But I'm also going to reinvigorate this channel, and I'm going to invent stress management for small business owners. And I'm going to take what I've incorporated and learned in all of the information in going to the Jim Pattison Clinic and combine it into a really good program. I've got a 2 and 4 hour seminar on the shelf. All I have to do is dust it off and present it. When I used to teach reflexology, meditation, and stress reduction techniques. So let me take you on a little bit of an outline of what they do at the Jim Pattison Clinic. I've taken 2 courses now, or 2 separate entities, I guess. One of them is the exercise program, specifically dedicated to people that have injured their necks. And then they've got another exercise program for people that have specifically injured their backs. And I'm just wrapping up the exercise program. It's a month-long program. I have completed the self-management course, and that's what we're going to talk about today. So they do really neat things like, for example, they will talk about chronic pain and medicine or medication. They'll give you an outline. They will tell you about types of pain. They will tell you about basic medication rules, goals of drug therapy. The whole thing, it's so good. Drug therapy option classes. They will get into how opioids work in the body if you're on opioids. They give you a whole bunch of information. And dependence versus addiction, tolerance, dependence versus addiction, metabolism, summary. So what they do is they hold classes from 10 in the morning till 1 or a little bit after 1 for 6 weeks for the self-management class. And I have found them really, really good. About 80 to 90% of it I already knew from when I was a holistic teacher. Oddly enough, that the pain center is big on visualization, relaxation, and meditation. So that's what I've been doing for years. And now it's becoming mainstream for people that have chronic pain. So we're going to be doing a series of podcasts on these papers. Because here's the thing. I got into the pain center in about 10 months. I think somebody canceled, or I don't know exactly how I did it, but just thank goodness I got in. Some people, it takes up to 4 years to get into that program. And 4 years of suffering is way too long. The wait list for these pain clinics is growing exponentially. And if I can help you out at any time by doing these podcasts, I will certainly do so. As a matter of fact, I got about 1,000 hits very, very quickly on my podcast that I did about miracle balls. So I'm going to be giving a series of podcasts about what they teach, how I saw it, and how I think it could help small business owners reduce their stress in their daily lives as well. So this is Rick Holland for Healthy Tech Talk, and I hopefully will be seeing a lot of you around town. And I think this is going to be a very, very good seminar production because we can. I've got some really interesting ways of explaining pain, of explaining how to deal with it, of explaining how to live with your chronic pain. And a lot of people suffer unnecessarily. I know I've met a couple of people. They are almost so crippled up with pain they can barely move, yet they have to go to work because they just don't have any other way to make money. So it's a real tough battle, uphill battle for a lot of people with chronic pain. So I understand that. I've been there. It was a year and a half before I finally got on track, and I went to physiotherapists. I took acupuncture. I did the massage. I did everything I possibly could to alleviate the pain. And working through it for a year and a half, finally got to the point where I got mobility back and I got my life back. But it is still, I mean, I've still got to live with chronic pain. I can't lift, I shouldn't lift over 10 to 20 pounds. In the future, hopefully I will be able to learn how to lift easier. There's a really good program out there called the Alexander Technique, and I want to research that as well to find out how people with chronic pain can lift without injuring themselves. If they have a neck injury or if they have a back injury, I think there's some specific things that we can talk about there too. All right. So this is Rick Holland for Healthy Tech Talk. I will talk to you next show. Thanks for coming by, folks, and keeping in touch with our show. Bye-bye. Take care.